Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning, Richard.
Good morning, everybody.
Happy Valentine's, Richard.
I have to tell you, this is an important show.
But you know something, for a lot of people, Richard, don't get any idea. A lot of country, Valentine means friendship. So it's Friendship Day.
Oh, so, Friendship Day.
Right,
oh,
so
good.
Happy Valentine.
Oh, Happy Valentine's Day, everybody.
In a Happy Valentine.
Happy Valentine.
How you say that in Russian?
There isn't
there's
a
Happy Valentine.
Oh, okay.
Yeah.
But with a Russian accent. Happy Valentine. Something like that.
Dr. Mencia, I am a part of an organization in Broward County. It's the Broward Women's Auxiliary. It's a big, in fact, Maria Saldani started this whole thing.
Oh.
Anyway, so I go there and everybody stands up and says what they do. And one woman stood up and said, Anita, I listen to your radio show every week. And this, I'm a pretty important woman. She said, but you and Dr. Mencia, you laugh too much. And I said, so what's wrong
some of my
with that?
patients say that. Right. You have too much fun. I said, that's what we're there for.
I know, that's what I said.
Why would I come every Saturday if I'm not having fun?
Absolutely. I mean, we do
I look
have
forward
fun.
to this.
Do you know what made this the car? There's a show on Saturdays from 10 to 11. It's the Car Guys. They're hysterical. They laugh all the time. Everything they say is funny. And I just listen because it's so much fun to just listen to them.
You know, the brochure in my office has my picture. I mean, a really nice picture of me, like 20, 40 years ago, or something like that. A nice picture of me. And one of the patients, she's listening. She listens every Saturday. She's very favorite. She says she put the clock to make sure she's up. Mm-hmm. And she said, now you're not tricking me anymore because I get up at 6:15. Just in case you decide to go in at 6:30, I'm ready for you.
She doesn't want to miss you.
But she was saying, you guys should have a picture, you and Anita, because that way when we listen, I look at both of you. I only look at you. I don't see Anita.
Okay,
I don't even know what Anita looks like.
Okay, you know what? In the Boomer Times, we're going to have a little picture of us, wonderful world of us, done.
There you
tell
go.
her, done.
That's it.
We'll do it starting in
deal.
March. Oh, yes, we're the Anita, it's the Mencia and Finley radio.
Yeah. But let's talk about something that is very crucial, I guess, as we age, and it's applicable to a lot of the boomers, a lot of those baby boomers out there. You start taking prescription at a young age, and people think medication are really meant just for the elderly, and a lot of the conditions that we experience as we age start at a young age. For example, osteoporosis start in your 30s. And people say, well, I'm too young. I'm not going to worry about taking calcium or checking my vitamin D or do any preventive measurements because I am no osteoporosis. And probably you are not detectable. And we have to look at things on what is available today to detect osteoporosis. It's the DEXA scan. And at one point, it will be obsolete because it detects osteoporosis at a stage that is already present. So hopefully in the future, we will have other instruments that can help us detect pre-osteoporosis, pre-osteopenia. And that would be so nice, to be able to detect things so that we can prevent it. But one of the rule of thumb we can use, if you have a strong family history of X condition, think that you have the gene of that. And then you can practice prevention. Don't wait for, equipment to come out and tell you that you are at risk of diabetes, that you are at risk of osteoporosis.
But Dr.
And having said those things, there are medications that we're going to end up taking, either as a prevention or because we already have the condition. And I wanted to talk about prescriptions and, how can we handle our prescriptions? Because the prescription is not like 50, 60 years ago that you go to the doctor and the doctor will dispense right from the office what they wanted you to take. Now you go to the doctor, you see a nurse, you see a secretary, you see we have a patient liaison at the office that work with us. We have a operator who is also a medical assistant, so it is knowledgeable. And sometimes you are calling from home, and you might be calling for the wrong medication. So the mistake can go from the patient, him or herself, to a middle person that work with your doctor, to your doctor, that is looking at the chart and looking at the wrong list of medication, to the pharmacy that might misread the prescription, or might misinterpret the prescription, or might pick the wrong bottle. And the prescription is well written. Everything had been done up to that point, and the pharmacist or the pharmacist technician, because a lot of time when you go to a pharmacy, it's like when you come to a doctor's office, not everybody are doctors in there. They are nurses, they are assistants, they are secretary. So, we have to be cautious that prescription in today's day, they go through so many hands, and it's a big process by the time you put a pill in your mouth. So we have to be cautious, even if we are taking the right amount of medication, that we are getting the right prescription before you put it in your mouth, because there are so many mistakes. A lot of time you go to a hospital, you say, oh, I'm safe. I'm in a hospital. Nothing is going to happen. It's even worse, because the process is much longer now by the time it comes to you. And some of the hospital now, they are automated. So you have little robots going around, bringing prescription to the rooms. And so, there's so many mistakes that can go on that when those people go in, you say, oh, I'm in a hospital. Nothing is going to go wrong. Well, they have more equipment to save your life if something do go wrong. But they do, we do make a lot of mistakes, even in the hospital when it comes to prescription med.
Okay, so now you have to help us to know what to do. Now
and
that
I
you
said everything I was going to say. That's it. I'm done.
No, but now you just opened up a can of worms.
I can give my phone number and go home.
Okay, let me give you your phone number anyway. Here, that's a good idea. Phone number. Call Dr. Mencia to know about your prescriptions and everything else at 954-489-1345. And he's on Commercial Boulevard, or their other Palm Beach office, which is 561-270-6494. And the other thing I want to keep doing this because I want to know, how serious is it if you take the wrong prescription? I was wondering about that.
It can be very serious.
Give us an
first
example.
Of all, let's say you are taking a medication for your heart to slow down your heart. And by mistake, they give you a medication to speed up your heart. Well, if you speed up your heart and your cardiac condition call for a slow heart, a fast beating heart can throw you into congestive heart failure. And you start feeling shortness of breath, you start feeling the palpitation, and you end up in the hospital. The wrong medication, all pills, most of the pills have to be processed through the liver. When you're taking certain medication, they go through enzymes that are dedicated to process different type of chemicals. So when you have one chemical going through one enzyme, let's call it a window, and here comes this big bully saying, everybody step aside because I'm going to have better affinity to this window. I'm taking over. Everybody else is going to stay behind now. And those medications that stay behind is going to have a major effect than what they're supposed to have. So the complication can be very detrimental. Some people can end up having a stroke, going into a coma, having fluid in the lung, what we call congestive heart failure. They can have, if they suffer from asthma, they can have an exacerbation of their asthma and even die, because the lung can respond, an asthmatic patient or a patient with emphysema, the lung can respond to a chemical on the air, and you get a mild attack and you take medication. But this one, when you get a major attack, it's like the lung, the breathing pipe going to a spasm and shut down. And it's like somebody strangulating, and you will die.
Wow.
So it can be devastating. It can be a catastrophe, taking the wrong medication.
Okay, so now let's go to the wrong medication. So how do we know? Let's say you've been on a medication for 2 months, a year, everything's fine. And now the drugstore, you go, you fill it, and they've made a mistake. I mean, should you be checking? How do you, when you come home, should you check your medication? How do you do all that?
Just like you check to make sure that it's Bill when you go to bed, that this is Bill, this is my husband in bed. Just like to make sure.
Is this you, Bill?
You want it?
We knew you get sex into this.
Sex had to come into the play.
You're playing bed with me, Bill. I just want to make sure. Oh my God, this is the funniest thing.
You look at your pills, and your pill has certain shape and certain color, and even the writing on the pill, it gives you a specific. And one other thing, most people walk around with a cell phone, and on their cell phone, I'm going to open here, you have a camera, and in that camera, you can click a picture, like I'm doing here. You can look at that picture, and you can magnify it. And make sure that whatever you cannot read with your glasses, you can read with your phone. So you can take a picture of your pills, and you can look at the inscription. So if we say, let's say, RX 715, even if they give you a different color medication, because let's say you are taking generic, still have to give you RX 715.
Oh, it's written on the pill.
It's written on the pill. So if you don't take that many pills, that's one thing you can do. You can take a picture of your pill, and when you go to the pharmacy, you open your bottle there. A lot of people take the prescription home. When you go to the pharmacy, you can open the bottle. If you recognize them and you have the picture on your phone, you can show the picture to your pharmacy and ask them, are you giving me the right thing?
Wow.
Because this looks different to what I normally take. And people just, out of memory, they recognize what they take. It's either heart shape, or it's oval shape, or it's rounded. It has a line in the middle so I can cut it in half. Look at what the pharmacist is giving you, because like we said in the introduction, mistake will happen at any step of the process.
Now, have you seen errors like this with patients?
Oh, yes. A patient receiving the wrong medication, and they come to me and they say, doctor, they gave me this, and I just want to make sure they gave me the right thing. And we'll open it, we'll look it up, and we say, no, we call the pharmacy, this patient got the wrong prescription.
Wow, what a very important job that pharmacist has. And I have to say, when I go in now and I see them, they're all busy, they're all doing things. It would be very easy. They take a phone call,
easy,
right? Because they've shortened the help now. And you see someone on the phone and they're doing it. So now for all your patients, I guess we have to warn everybody, including I don't take medication, but I know Bill does. He has his list of 6, and I notice him looking at all of them as he takes them and making sure everything's right. Exactly.
You have to make sure, look at them, and you always have some reminder of what is it that you take normally at home, like taking a picture of the pills and things like that, like that. To have a list with you and have it on your phone. You can put it on your phone. There's a little place in your phone that you can write notes. Let me see, what is it?
No, there is. There's a note thing. Exactly.
And you can go and write a little note.
Down what it is.
That note, what you want to put there is, if you have any allergies, write down your allergies, and be specific. So some patient will say, I'm allergic to aspirin. Well, what does that mean, that you are allergic to aspirin? You can have the person that say, I get a rash. That's a true allergy. My throat closes when I take an aspirin. That is a true allergy. But when you get a little upset stomach because you take aspirin, probably you had a gastritis once in your life, and you took an aspirin, and of course it reacted wrong. You should not take aspirin if you have a gastritis or an inflammation, because aspirin will make you bleed and will make the gastritis even worse. So that is not a true allergy. That's just a reaction of a condition that you had at that time. And why is that important to me if you are in an emergency room? Because if you're having a heart attack and you have a little gastritis, I don't care. I'm going to give you the aspirin because it's going to save your life. And what I will not do is have you swallow the aspirin. I will have you chew it. So it doesn't have to be processed in the stomach. You can chew the aspirin and it's processed in your mouth. The process starts in your mouth and it won't do that to you. So you have to be a little bit specific. What do you mean by, I'm allergic to something? I'm allergic to aspirin because I don't like the color. Okay, write it down. Maybe I give you a different color. Maybe I can put it on dye for you so you can have it.
I'm not going to let you go with the aspirin. I have to ask you a question about the aspirin. There's all kinds of aspirin. Are you talking about a baby aspirin? When you say to give someone an aspirin, what's the
the ideal aspirin usually is the baby one, and they come that is not coated so you can chew on it. If you're having a person having a heart attack, we should all carry with us, the regular aspirin. The baby one is 81 milligrams. The regular one is 325 milligrams. It's a stronger dose. Somebody's having chest pain and they think it's a heart attack. You take an aspirin, you chew it, and you drink some water just to rinse your mouth, and then you call the emergency and do whatever you have to do. But chewing an aspirin can be a lifesaver.
Oh, and why? I don't want you to get off that. Why? What is it in there?
Because if you are having a heart attack, you need to keep the blood flowing. It's going to thin out the blood very fast. So when you chew it, your mouth has a lot of vein that will absorb this, and it will bring it down into the heart much faster. So you can chew an aspirin, and or as you are calling 911, just make sure that you have an aspirin available at home, and chew one.
Okay, and the other thing that happened to me, and I'm sure I'm talking about prescriptions, it's one thing to have it one time a day, once a week, or once a month, or 3 times a day. I'm on testosterone, and I happen to know what I'm supposed to do with it. And the last time I got it, they wrote down that I should do it every night. And I know that's not true. Can you imagine if I did testosterone? Right. I'd be one big hairy ball, and I'd be on I'd be right there. but I happen to know it's wrong, and they did it wrong. They said it once. Oh my God!
Yeah, so the instruction can be wrong when you get a prescription. So you know how you do things, and the instruction can be wrong.
Because that would also fast termination. Right?
Oh my God! Poor Bill be like, what happened to you? I'm taking too much testosterone.
But see, we do this so casually about medication, don't we?
We trust everybody, and we have to be cautious that even though we trust our pharmacists and our doctors and the nurses, they all can make mistakes.
And you also know that people,
except at AGI, we are not.
No, that's right. But a lot of people don't do. I mean, I do everything through you. I don't go.
Ina, as the manager, she has a big oven, so she say when you make mistake, we'll cremate you right here.
Oh yeah, that's right. No, she doesn't. She's very tough. Everybody's got to really behave. That's true. She's a tiger. But but the big thing about all of this is that a lot of people will go to different doctors, and they go to one doctor and they prescribe something. They go to another doctor, they prescribe something. Now they're on all this medication and you don't even know. You'll say to them, what are you on? Well, they don't know and they don't remember.
Yeah, there was a doctor that got really upset with me because he was going to put a pacemaker. He's an elderly patient, so he said, they called the geriatrician for clearance because, the person was so old. And they wanted to get a geriatrician to do the medical clearance. So I went there and I stopped the surgery, and the surgeon, the cardiologist got so upset. Why are you stopping my surgery? because the patient taking 2 eye drops that slow down the heart, and you yourself is giving the patient a beta blocker that slow down the heart. It's 3 medications doing the same thing. And of course the heart is going to be on the 30th, but we have to fix the medication. She doesn't need a pacemaker. So we've rearranged the medication and the patient live happy ever after.
Yeah.
Without a pacemaker. So,
right.
Sometimes we go through procedure and things like that. It just, we need doctor to talk to doctor, and the patient need to be aware of that. There are a lot of times, that's why on the center, I love my center, the fact that when you see even the podiatrist and the podiatrist or the dermatologist has a concern, we come in the hallway and we consult each other. They say, okay, what other medication is this patient taking? I want to give this medication to the patient. And we consult with each other to make sure that globally we're doing the best thing for that patient. So that's one of the things that in the center is help us prevent some of those mistakes. We are not mistake-free. We're all going to make mistakes. We're human. But we keep, we have counter-check system that we usually catch it within the office and fix it. The other thing you want to do if you take more than 4 or 5 or 6 prescriptions, you get blood drawn at your doctor's office, hopefully, a Quest or a LabCorp or something like that. You get at your doctor's office. If you go for blood drawn every 3-6 months, bring all your pills. Bring all your medication with you. Bring the bottle and say, this is what I'm taking. Just counter check with what you have on your computer system, because everybody's using now computerized record. And the computerized record can go in the tablet or on the phone. And when you call in the doctor, they can review that. When the pharmacy is calling the doctor, they can review and say, no, there's a contraindication between this drug and that drug. And I just had a patient that the pharmacy called to renew the high blood pressure medication. And when I open the system and I see that she's taking 3 high blood pressure medication, I say, I want to give this one QD once a day. I said, no, I don't want to put once a day. Put this one in the morning, this one at lunchtime, and this one put at noon, at PM, so that we break them down, because she doesn't need all 3 medication, but I don't want my patient to take all blood pressure medication at the same time. You want to sort of spread them out so that you accomplish the objective of decreasing the blood pressure. Why do we want a normal blood pressure? So we don't get a heart attack or a stroke. But if you take everything in the morning, by 10 o'clock at night, it's out of your system. So you are at a high risk of a stroke between midnight and 6 o'clock in the morning, even though you had been well treated. And you go to your doctor's office and they check your blood pressure at 10 o'clock in the morning or 11 o'clock. You just took your pill at 7, so your blood pressure is perfect. But nobody's going to go home and check at 10 o'clock at night. So that's why I tell my patient, if you do have a blood pressure machine, check in the morning when you normally take your medication. But from time to time, also do a before bedtime blood pressure check, to give you an idea.
That's interesting. I have never done that before. I should do that. I do it in the morning, as you said.
Most of us
right.
just
I'm not taking medication,
yeah.
But usually you do that. But then I ought to do it at night too. Should it be higher at night?
Yes,
Depending, I
yes,
guess.
and because the circadian rhythm, because of the hormonal change that we go through, it's a normal hormonal change in the 24-hour clock. The hormones that have tendency to increase the blood pressure, and it makes sense because in the morning you're going to get up and start working and doing things. So the heart rate want to go up between 3 and 6 o'clock in the morning. Your blood pressure start going up because, it's getting your body ready to get up to move around and work. So all of those things that increases blood pressure tend to happen overnight. Mm. And as the day go by, then it drops again toward the evening. So that's why you see a lot of people that they say, oh, mom or dad or uncle went to sleep and woke up with a stroke or, died in their sleep because they could
amazing.
have had a major heart attack during their sleep. They didn't even feel anything. A lot of people that they say, how did I have a silent heart attack? I never felt anything. It could happen during your sleep. You can have a little chest pain during your sleep. You don't even feel anything. And then you wake up the next day, la-di-la-di-la, go to work, to go through your thing. And you don't even know that night you just had a little heart attack or a mini stroke, and you don't even know that you had it.
So la-di-da-di-da. And Dr. Mencia, Dr. Andy Mencia has been our fabulous guest, of course, in the wonderful world of wellness. And the phone number to call is 954-489-1345. He is open today. Go in there, get your flu shots, get your pneumonia shots, get whatever you want.
Who we have there? We have home visit, Dr. Richard. Dr. Marrero doing pain management.
And Dr.
Abobian, the dermatologist, is there. And then we have 3 dentists in the dental department seeing patients.
Well,
so we
and Dr. Barber is waiting to come on the radio show. Your friend Monica.
Bring it on down.
No. You know Dr. Monica Barber, and she's going to be on the radio now. You can say hello to her.
Hi, Dr. Barber.
Okay, well, we're so happy that you were here with us as usual. Thank you. It's great. Thank you, Dr. Mencia, so much. I really appreciated my pneumonia shot this week, and I'm actually going to go and visit Dr. Barber and get my eyes checked there, too.
There you go.
Yeah, I'm just using everybody here. Thank you for being here. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.